I was interested in medicine from a young age. My dad is a dentist, and I think he kind of set the example for me early on that being a health professional was an interesting job and a good way to give back to your community as well. I think in the sort of modern setting, we've gone away from like the doctor telling the patient what to do and everything. It's more of a kind of a collegial relationship now, I think, where the physician obviously brings that expertise to the table, but it's listening to the patient and what their personal goals are for their health. I'll be practicing at the Stones Crossing Health Pavilion on the south side in Greenwood, Indiana. And we have full-scale services, including lab and imaging and physical therapy on the first floor. And so I think it's really nice that those ancillary services are available to our patients in a single location. And I think community is just a very friendly place to be. And they were founded in Indianapolis, so it's kind of a homegrown business, although now, I mean, very large, obviously, hospital system. But all the docs I've met so far have been wonderful and very excited to be part of the team here. I have worked with the MyChart tool. I think that's a really nice thing for patients. It's a more convenient way to contact the office. You get a lot of information in terms of lab results and things and making appointments. It's a very nice thing for patients to have, and people tend to be a lot more computer savvy these days, so having that access point is nice. Anytime that someone has come up to me, if we had a moment where a major medical issue was caught and we maybe prevented something more serious happening, I do specifically remember an older gentleman who was having some heart issues, and he came back to me maybe a couple weeks later and was like, "Doctor, thank you so much. If you hadn't really, encouraged me to do this, I might not be here right now." And so moments like that, when you really feel you've made a serious difference in someone's life and in their healthcare, those are always my most proud moments. I love the South Side. We moved to the South Side after my husband's also a physician. He's an emergency physician. We did residency in the Indianapolis area and moved to the South Side during residency. And we just like the vibe on the South Side. People are very friendly and open. And I'm from Southern Indiana, so I feel like that kind of feels like a little more like home for me. So I love to read. I was an English major in addition to being pre-med in college, and never lost my inner bookworm. So I try to read a book at least every couple weeks. So I think it's maybe kind of funny. I'm a little bit of a fashionista, and I enjoy shopping and kind of, getting accessories and things like that. My husband would tell you I like shoes and handbags way too much. But that sort of secret love and enjoyment of fashion and following things like that. Hi, I'm Heidi Bagwell. I'm a family medicine care physician with Community Physician Network, and I've been in practice since 2007.